Today I will talk about management of ward. This is part of my series of lectures on hospital management. This is my lecture outline. First, I will talk about types of ward, then functions of a ward, design of a ward, including sections of a ward, various ward design, management of ward, including goals, strategic management, operational management, housekeeping, and manpower management. Finally, I'll talk about matrices and key performance indicators. Wards can be divided into general ward and specialized ward. Specialized ward include emergency ward, ICU, CCU, nursery, burns ward, post-operative ward, postnatal ward, and wards of various specialty. Functions of ward can be classified as ward as a substitute for a home, treatment of patients, rehabilitation of patients, medical and paramedical teaching, and medical research. Now, design of a ward. There are various sections of ward, including patient housing area, ancillary area, sanitary area, auxiliary area. Patient housing area. A typical ward have single bedroom, double bedroom, and 4 to 6 bedrooms. There should be at least 2 to 3 single bedroom, 2 to 3 double bedroom, and rest as 4 to 6 bedded rooms. And a total of 40 to 50 beds can be there in a particular ward. For critically ill patients, smaller rooms are preferable, especially of single bed, and an area of 120 square feet per bed is desired. And for critically ill patients, their bed should be as near possible as nursing station. This is a typical patient housing area. Beds should be of length 6 feet 6 inches and width of 3 feet 3 inches. There should be a space between two beds, a minimum of 3.5 feet. Space between wall and bed should be at least 1 feet, and space around each bed, that is, space for each bed, should be 120 square feet. Ancillary area include nursing station for management of ward, treatment, work area for small procedures, pantry for dietary services, a ward laboratory, a side laboratory may be there in some ward, and store for storing items. Then sanitary area include bath and toilets. There should be one bath for every 8 patients and one toilet for every 5 patients. Then there is a dirty utility room and store for sweepers and a wash basin. Auxiliary area include doctor's duty room, seminar room for teaching and education, attendant room which should have a comfortable environment and a television and attached toilets, then lockers for staff and recreation room. Then let us see various designs of ward as per Riggs pattern. So this is open ward. This is Riggs ward. These are low partitions. Then this is unilateral Riggs ward. So this is one side of nursing station. This is bilateral Riggs ward, both sides of nursing station. And this is a T-shaped ward on all sides of nursing station. Then management of ward. These are goals of management to provide highest quality of medical care to the patients, to provide desirable environment, to provide highest job satisfaction to employees, to provide training to employees, to provide facilities to meet the need of visitors, attendants, and relatives, to get image of an efficient and effective treatment facility. Strategic management include determining the capacity of ward which is required and which is present, determining the manpower requirement, determining equipment requirement, setting standards for quality care of patients, training of employees, and measurement of performance. Operational management include day-to-day management to provide good medical care to patients, to provide appropriate nutrition to patients, to provide comfort to patients by managing environment, and to protect patients from infection, accidents, and other hazards. Then other day-to-day management activities include carrying out special procedures, sampling for clinical laboratory, arranging radiology services for patients, management of emergencies. Then maintenance and repair of equipments and facility, inventory management of supplies, coordination with other departments, teaching of medical and paramedical students, supervising housekeeping services, and record keeping. Housekeeping include routine cleaning and dusting of windows and walls, mopping, bedding, and rodent and other pest control. Then manpower management. No hospital is better than staff. Manpower planning include following activities: health need approach, service target approach, economic demand approach, manpower population ratio approach. These ratios include doctor population ratio, nurse bed ratio, etc. So this is how we can plan the manpower requirement. WHO approach include workload indicators of staffing need. Then manpower planning steps include assessment of present manpower strength, forecasting of manpower demand in future, estimation of turnover rate of manpower, and steps of acquiring manpower include recruitment, selection, and placement and induction. I have separate lectures on human resource management on my channel. Then manpower of award include a treating doctor, nursing sister, who is usually in charge, staff nurses, ward clerk, and other paramedical workers, and sanitary staff. Then various matrices and key performance indicators. These include bed occupancy rate, which is in percentage. An ideal bed occupancy rate should be 85 to 90. Less than 70 and more than 95 is a matter of concern. The formula for bed occupancy rate is total patient bed days divided by total number of functional beds into number of days in a month. This entire thing is multiplied by 100 because it is in percentage. Then length of stay or average length of stay is total patient bed days divided by discharges in the year. And discharges include deaths, leave against medical advice, referral, and discharge after treatments. Then leave against medical advice rate average. This is equal to total number of leave against medical advice divided by total number of admissions per thousand. Bed turnover rate, total discharge including death divided by total number of functional beds. Then referral out rate is total number of cases referred to higher centers divided by total number of admissions. Then for a surgical ward, I have taken from this interesting publication on internet. Then there may be provider level indicators and area level indicators. Provider level indicators include procedure volume indicators, mortality indicators for inpatient procedures, mortality indicators for inpatient conditions, and procedure utilization indicators. So interesting readers are advised to go through this publication, which is available on internet. Then we can undertake patient satisfaction survey for quality of nursing care, doctor-patient relationship, housekeeping, patient satisfaction regarding medical care and investigations done. So this is all for today. Thank you very much.